Let's talk about proximal fractures of femur. These are basically of two types: fracture of neck of femur and intratrochanteric fracture. Coming to the differences between the fracture of neck of femur and intratrochanteric fracture, the first difference is that neck of femur fracture anatomically occurs above the intertrochanteric line and it's intracapsular, whereas the intertrochanteric fracture is extracapsular. Coming to further details, on examination you will find mild pain over the Scarpa's triangle in the neck of femur, whereas pain tenderness in the trochanteric region in the intertrochanteric fracture. Shortening will be less than 1 inch in neck of femur fracture. It will be more than 1 inch in intertrochanteric fracture. Degree of rotation of leg will be less than 45 degree, greater than 45 degree. In neck of femur, it will be less than 45 degrees. In intertrochanteric, it will be greater than 45 degrees. Coming to the complications, as the profunda femoris artery gives two branches, medial and lateral circumflex artery, and as these are compromised in the neck of femur fracture, the chances of avascular necrosis and non-union are very high in neck of femur fracture, whereas in intertrochanteric fracture, chances of malunion are very high. The other reason supporting the non-union fact is in the neck of femur fracture is because the periosteum lining the capsule lacks the cambium layer, which forms the osteoblast. It is less vascular and synovial fluid is also present. These all factors contribute to the non-union. Coming to the next point, specifically to the neck of femur fracture classification. There is an anatomical classification which classifies into three parts: subcapital, transcervical, basicervical. Subcapital has a worse prognosis, it's more proximal, the blood flow is coming in a reverse way. Then transcervical in the basicervical, which has the best prognosis. Coming to the second classification, Powell's classification, it's based on the angle subtended by the fracture. It is classified into three parts: less than 30 degrees, 30 to 50 degrees, and greater than 50 degrees. And coming to the third classification, which is the Gardens classification, which classifies into four classifications: 1, 2, 3, 4. First one is the incomplete fracture, then comes the complete fractures. In the incomplete, it's undisplaced. Type 2 is complete but not displaced. Type 3 is complete but partial displaced. Type 4 is complete fracture and completely displaced. The management. In management, first of all, in investigation, we will see the Shelton line broken. Shelton lines is found by the inferior margin of the superior pubic rami and till the medial side of the femur. Coming to the treatment part, it depends on the age of the patient. If its age is less than 65 years old and the fracture has occurred within the 3 weeks, we will go for close reduction internal fixation with the cancellous cannulated screws. But if the fracture has been over 3 weeks, then we will go for an MRI. We will see whether the head is viable or not. If it's viable, we will check for non-union and we will also fix the fracture. If there is a non-union, we will do a osteotomy. Osteotomies are of various types, like the McMurray's, Bakshi's, many others. Whereas if the head is non-viable, we will go for vascularization procedure also. And coming to the second group, if the age is greater than 65, we will either go for the hemiarthroplasty or total arthroplasty. Hemi, if there is no earlier complications. In hemi, we use processes like Austin Murray and Thompson. The difference between hemi and total is that in total, along with the head of femur, the acetabulum is also removed. So this was all about the proximal fractures of femur and neck of femur fracture in detail. Thank you for watching.